The one other thing that I want to tell you, and this is something that you're going to hear in the media, women using estrogen therapy, you're going to get dementia. Here comes another women's health initiative thing. So the study that came out about using estrogen therapy in women, in them going on to develop dementia, number one, they were using synthetic estrogen, and number one, they were not using testosterone. Remember what we already talked about, how protective testosterone is in a brain for men and women? So for them to come out with this generic statement saying using synthetic estrogen is going to increase your risk of developing dementia as a female is awful. And when I first read this, and this was a few months ago, I said, oh my God, here we go again. My life is going to be miserable for the next few months, because our phone is going to be ringing off the hook saying, oh, shoot, I'm getting estrogen from Dr. Brzezinski and now I'm going to get dementia. I'm not going to give you dementia, and I'm not going to give you breast cancer. So, think about things realistically when we're talking about hormone replacement therapy when things come out in the media. What type of hormones are they talking about, and what combination of hormones are they talking about? Synthetic hormones, I will not prescribe. I won't give you synthetic testosterone injections. I'm sorry, but I'm not going to do it.
Who makes the natural type? I mean, does Big Pharma not manufacture it?
They do not. So it's all made by peptide pharmaceutical or peptide companies that produce natural things. So there are probably 4 different companies in the country that are FDA approved that make bioidentical hormones. Those are the ones that we're going to want to use because they're highly regulated by the FDA. Right. No, they'll never be made by Big Pharma. No, oral bioidentical estrogen is made, but remember, oral bioidentical estrogen is made oral, and it's also made in a little patch that breaks out your skin and you itch and scratch and it leaves red marks all over your body. Those are made by Big Pharma, but remember, we never want to swallow estrogen ever. That's Big Pharma, and does nothing to reduce your risk of developing heart disease or anything of that nature. There's very little of that is absorbed systemically. Vaginal estrogen is a completely different ball of wax because you're going to get no health benefits from that at all. And actually, I'm not even sure that you're going to get any benefits from putting it in your vagina either. So, but that's a completely different ball of wax. That is safe to use, and it is safe to use in women who have estrogen receptor positive breast cancer as well.
I was going to ask you about that. So what about women who have had in the past, like myself, who have a lot of systemic sensitivities to estrogen? Mm-hmm. It's immediately just not received. I can't deal with all the side effects. And
right.
Is it different with the bio?
It is, because guess what? We can regulate the dosing. Before, I didn't have a choice. Here's what you would get. If you don't tolerate it, here, let's give you this prescription. I can't regulate the dose. There are women who are sensitive to estrogen. Most women that have been menopausal for several years, let's just say, you're going to have some sensitivities to when we optimize your estrogen the very first time. We get this all the time. Oh, shoot. My breasts are tender. My nipples are sore. I feel like I'm engorged. I feel like I'm lactating. You get some breast tenderness, let's say, as we're optimizing estrogen the first time. That never happens again once we get you to nice levels of estrogen. And we can pretty much predict who that's going to happen to, because these are going to be women that say, oh my gosh, when I was a teenager, before I had my period, oh my gosh, my breasts were swollen, they were hard, they hurt, all of that stuff. We can pretty much predict that if we're gonna try to optimize your estrogen again, that may happen to you. But one thing that's really interesting about me that I've learned over these years, I'm so conservative with dosing of bioidentical hormones, because guess why? I can always add to, I can't take away. And so what if in a few minutes or a few months I have to give you a little bit of extra this or that? You haven't had hormones in how many years? Do they really need to be optimized in 4 or 5 weeks? No. This is a recipe in evolution. And I always say this, a recipe is a recipe because it tastes good, not because you alter it. So once we find a recipe that really works for you and you're feeling great, we don't change it, because that's what you need. But being conservative is good with somebody like you. I get a few phone calls every week about, oh my gosh, I don't know what's worse. Should I wear a bra? Should I not wear a bra? It doesn't matter. Anything that's rubbing up against my breast, I've got this tenderness and so on and so forth. Listen, it's gonna go away. But if I can't get you to that point, then, we're gonna reduce your estrogen levels.
Right.
Concerned about hair loss too?
Oh yeah, concerned about hair loss.
Do you remember we just said
Yes.
hormones don't cause hair loss,
Yeah.
right?
People say that when you take estrogen, you can expect hair loss.
No. So, not estrogen related. Testosterone is interesting. The very first time that we optimize your testosterone, what are we doing? We're waking up those androgenic receptors. What do androgenic receptors do for females? Those are the receptors on our hair follicle. They're the ones that can cause a little bit of breakout or acne. 2% of the women that we optimize testosterone can actually shed a little bit of hair when we first start, or they may actually break out in a little bit of acne. It never happens again after that. So I always say this. Remember we talked about hair loss? Over 2/3 of all women will normally thin your hair over the age of 40 for no reason. When we wake up those androgenic receptors, it's out with the in or out with the old, in with the new, because you are going to shed that hair that's been dormant forever, because we've never had any stimulation of those androgenic receptors. That's in 2% of the women that we optimize testosterone. Women who have been prone to cystic acne in their life, or even in their 40s that have had cystic acne, we can certainly foster an outbreak of that. But there are really, really great remedies for that. And it never happens once we get your testosterone level up to where it should be, and we don't deviate from that. So everything is firing. The other thing is, and I never see this in the little tiny skinny women, but sometimes in the fluffier women, when we're first optimizing testosterone the first time, you can really have a little bit of fluid retention because you're storing some fluid in muscle and things of that nature. And we can sometimes see even 3 to 5 pounds of weight gain when we first start to optimize your testosterone, but that is self-limited. That normally goes away within a few weeks. And that's just fluid retention of trying to get that testosterone level back where you were in your younger years.
What's the percentage of women you've treated with hormone replacement who have not been able to tolerate it?
0.
Really?
Yeah, 0.
Only taking that synthetic stuff.
Well, I never took synthetic.
Right, 0. I'm going to tell you the most common thing that I hear from both men and women that we fully optimize their testosterone. And listen, it might not be right away. It might take 2 or 3 changes to your recipe before you say, oh my God, this is it. But the most kindest compliment that I hear and that we hear in our practice is, you are right. I feel amazing, and I have the most overall incredible sense of well-being. I just feel amazing. Those are great words to hear.
You're saying that, like, how do you determine what each person's perfect range is?
Oh, there's a lot of it that goes into creating your recipe. So it's age, it's liver function, it's thyroid function, hormone levels, whether you've had breast cancer, whether you've used hormones in the past, all of that goes into the equation of how we calculate a recipe for you.
It's really individualized for each person.
Everybody is different. Your recipe will never be mine. My recipe will never be yours. So when we're talking about optimal ranges of testosterone for a female, remember we're talking about getting you into that sweet spot, which is 150 to 250. My testosterone level runs in the low 300s. I'm a little bit higher than the optimal range. That's where I function the best.
So you go with how you feel. Like for
Yes, and I don't want you to think that lab is not important. Lab is important, but it is not the end-all, be-all for bioidentical hormones. It's about listening to the patient. I have a patient, I've been piloting her for several years, with bioidentical hormones, and her testosterone level has never gotten above 136. Well, it's not between 150 and 250, but guess what? She feels like $1 million. Why would I give her more? That's good for her. Some women function great on the lower end of the spectrum, and there's other women like me where, guess what? I need just a little more. When I first started optimizing my hormones, my testosterone level got to 164. And listen, I was much, much better. 85% better, I would say. And if that's how I had to live the rest of my life, I probably would have been pretty happy with that. But there were still a couple of things that I was lacking in. And so, you know, the biggest thing for me, remember the sleep, the drenching night sweats, you know, this was really awful. So they decided to boost me, and that's when my testosterone level went up into the low 300s. That's where I am the best. And my mental and emotional well-being is much better in my 300s than I am in the 160s.
Does it affect the dopamine
No,
production at all?
no, does not.
So if you are already diagnosed with, I have atrial fib, and of course I'm on a blood thinner, and a beta blocker, because I had a stroke. So would I at some point be able to come off those medications?
But what I'm gonna do for you to optimize your hormones so you're feeling better is not going to interfere with your atrial fibrillation, your heart function, your anticoagulation. You're not going to develop another blood clot, and you're not going to have another stroke because we're thinning your blood. This is going to augment what they're already doing with you with traditional hormone therapy. Many cardiologists will say, oh my gosh, you can't use hormones. It's going to make these things worse. No, it won't. It's going to make you feel better, and it's not going to affect anything that you already have. Are you going to come off medications? No. Bioidentical hormones aren't going to control your rate as far as atrial fib is concerned. Bioidentical hormones, even though it's not going to affect the coagulation cascade, but atrial fib puts you at increased risk of developing a stroke. So it's not going to improve those things, but it's not going to hurt those things. It can only make you feel better. Make sense? Yes. I'm not going to hurt you by optimizing your hormones, no matter what your indication is as far as atrial fib and blood thinners and things of that nature. I'm not going to interfere with that.
And of course I've heard that I shouldn't take the hormone.
You're right. You may never ever take synthetic estrogen or progesterone. You are right. Now you know why.
Yes.
But I'm not going to hurt you with bioidentical hormones. Okay,
Now, you said that 4 companies are FDA approved,
they are.
so does insurance cover any
Nope.
of that? None of it.
They do not cover any bioidentical hormones in any way that you're using it, safely anyway, in a topical cream, or you're rubbing it on your skin, or some bioidentical hormones are compounded into an oral capsule, which I do not prescribe, or they have the little pellet that you put into the subcutaneous
Yes.
tissue back here in your fanny. Those are not covered by insurance. It's not expensive though.
I was gonna ask, what's the cost and?
For females, it's about $450 each time that you come in for pellets, but usually that's only 3 times a year, so that's not bad. For men, it's a little bit more, but they're only coming in twice a year.
And what about for the creams, are they less?
They're more.
Really?
It's more expensive. Yeah, the topical creams are more expensive. And remember, I have this other motto about the topical creams that we rub on your skin. I've never had a woman that has been on the topical creams that has gotten to optimal levels of testosterone, because remember what our skin is. It's a barrier, and it's a barrier for a reason, to keep things out.
So the pellets are what you
The pellets are really the way to go.
The pellets are just estrogen, or they,
No.
it would be a combination?
Yep,
of-
combination.
Okay.
What if you don't want all of them? What if you don't want estrogen, let's say?
You don't have to get it, but there's not a good reason not to get estrogen unless you have estrogen receptor positive breast cancer. Then we have to alter your recipe. But there's no good reason for you not to get estrogen. I do have some women that I'm treating for osteoporosis. They still think, oh my gosh, I'm going to get breast cancer because you're giving me estrogen. All right, well, I'm going to prove to you that that's not going to happen, but at least let's optimize your testosterone so I can start improving your bone density. But it's really interesting. I just had a patient a couple of weeks ago that I finally talked her into using just a little pipsqueak dose of estrogen. So, listen, that's you feeling comfortable with the recipe that we create for you. Just because I feel comfortable putting these things in my body doesn't mean that everybody is. That's my job, is to actually show you how you can use these things safely, the benefits that you're going to get, but you have to feel comfortable with embarking on this journey, no matter what we use, whether we're using a cream and we're not going to get to optimal levels, or no matter what we're using. It's a journey in you feeling comfortable with about what we're doing for you.
Does insurance cover your office visits?
We don't have a per se office visit. I won't charge you for that. That's all included in, yeah. But we do let you, whenever you have your blood work done and things of that nature, there's a lot of people that won't let you even submit blood work to your insurance. I'm not like that. We have insurance for a reason. We've paid for it. We pay a lot of money for it. We might as well use it. I always let you try to submit everything that we can through your insurance. Even if it's bioidentical progesterone, a lot of the insurances will cover it because it's generic, so it's very, very inexpensive. I will always let you try to use your insurance to get that filled before we ever recommend a compound progesterone that might be a little bit more expensive. So I'm very good at that, trying to really help you get as much covered through your insurance as we can. But the actual bioidentical hormones, no.
What are they, like if you do it several times a year, like what are they made out of? And then like they just dissolve in your body? And
Yep, they do. So, it's all derived through plants. So soy and yams.
contained in, like when you take a pill, it's like made out of gelatin or something.
Nope, this looks like a little grain of rice, is what it looks like. Yep.
And you put it in with a needle?
Mm-hmm.
Does it hurt?
No. I'm the biggest wimp known to mankind. If I can get pelleted, anybody can get pelleted. So,
Put it in your
Dr. Hellman knows that.
put it in your body, your butt.
Goes in the fleshiest part of your bum. Then guess what? You never have to worry about it.
Can you feel it through the skin?
Cannot see it or feel it under the skin. That's where it's going to be absorbed. We want it in that nice soft fluff in your fanny. That's where we want it. Because that's where you're going to get the best absorption of it.
Surface area to work at.
Well, unfortunately, as female, no matter what your weight is, we always have a little bit more junk in the trunk than a man, right? So it has to go in that fleshiest part of your bum.
Okay. Good to know.
And then just a little bit seeps out like every day, or is it all?
Yep, just gradually dissolved over time. You won't, like I said, you're not even going to realize that it's in there, and
Until it's gone and you get cranky.
yep, when you start to do the little crash and burn at the end and your fuse is a little short and you want to strangle somebody and get rid of it, you know, and get away with it and all that stuff, yeah, that's when we know that you're already on the decline. But ideally, with bioidentical hormones, is we want to try to catch you at that time frame before you really start becoming symptomatic again of hormonal deficiency, and we're already building another setup in your body. That's what we're after. And every woman is different. And the longer that we do this, I can pretty much be able to calculate, all right, you're going to need 14 weeks between your hormones. You're going to need 16 weeks between your hormones. You're going to need 12 weeks between your hormones. And we get pretty good and pretty accurate and specific with how much of a time frame you're going to get between hormone insertions. Yeah. It's easy. It actually is easy. The longer that you do this, in clinical practice, it really becomes super, super easy to be able to identify. And typically what we're trying to do is we're trying to extend you out as long as you can. Because if I can extend you out to 4 months, that's great. That means I only have to see you 3 times a year. I never mind seeing anybody. That's not how I meant it. But I'd rather you only come 3 times a year to see me rather than 4 times a year. Some of the younger women who are newly menopausal, no, they're not going to get 4 months out of their hormones. Most of them really need to be redosed again, 12, 13 weeks. You know, women who are triathletes or they're, you know, super busy with CrossFit and things of that nature, they're going to burn through them a little faster. But most normal women, we're going to get you pretty close to 4 months.
How widely known across the country is this about the bioidentical?
Well, actually, I mean, you saw, you know, that it was really used back in the 40s, but really the pellet therapy was already starting to be used in the 50s in Europe.
If you start to, like we've been talking about it, and I started to ask my friends about, it's like one of those things that women, you know, you don't know about until you start asking about other people about it, or you start to hear, you know,
And then lots
like
of
now
people.
seriously, like everyone I've asked about, oh, well, I did, or I've talked about this, or I, you know, it didn't work because I did the topical, or I did,
Right.
you know, I mean, the lady at the store, I told you, was like, oh, I just feel so much better because Dr. Brzezinski, I just like, going these things to my mom and I, and my girl, my mom's like, you gotta get in there. But I mean, really, so I think once you start to talk about it more, you'll find out a lot more people are talking about it.
Us as women, we don't talk about this stuff. We don't talk about menopause. We don't talk about how miserable we are. We don't talk about how we pee our pants and our vaginas are closed for business because we're menopausal. We don't talk about these things. But I'm telling you, it happens in everyday life, and it happens to every woman. So one of the pellets that we use in our practice was actually created back in the early 90s. And so, you know, it's been used since the early 90s. Yeah.
Okay, so what's the next step? Make an appointment with you?
Yeah, and then what we'll do is we'll get your blood drawn, we'll sit down, we'll have a consultation, and then remember, you're going to be different than you and you and you and you and me, right? So we talk about here's where your levels are now, here's where we want them to be, and how do we get them there? That's the best place to start. I will not sit down and have a consultation with any male or female until they've already had their labs done. It's not helpful. I'm going to tell you the same things that I'm telling you today, But if I'm going to sit down and have an educated discussion about where you are with a hormone analysis, whether you're a male or a female, I want to know where you are now and where we need to take you. That's where the most benefit comes from a consultation from me. So we always will require that you can have to have your blood work done before you sit down and have the discussion with me.
The specific.
You're right.
Do you have orders, like, so for instance, if we have, like, my husband has a primary care doctor
Mm-hmm.
tomorrow, and I know they're gonna ask for blood work, and I have one coming up, is it something we can take and say to our primary care? let's
Yep,
ask-
I already have an order set of everything that we draw for a man and a woman. And so it's nice if you're going to go in and do, let's say, your yearly blood work with your primary care doctor, it's great. All we need to do is add on the things that I need. That's all. Many patients that I do bioidentical hormones on are not my internal medicine patients. They have other primary care doctors that I work very well with. And there's many primary care doctors that are referring patients to me for hormone management because not only do they not know about it, but they don't want to dedicate the time that it takes.
To understand it.
And honestly, it changes all the time. And so, honestly, I tell doctors all the time, bioidentical hormones alone is a full-time job. And unless you're going to dedicate yourself to learning and being able to provide the best care that you can for people, you should never do it, ever. And so, you know, I have a lot of physicians that refer to me because they are not going to spend the time to learn about bioidentical hormones. So,
I can describe the cream before to put on the urethra to keep that little hood from, you know, like, whatever the thing is. But if you get the pellets, do you still need to do the cream there?
no,
or-
no, and you won't have to use the vaginal estrogen either. That's nice. So we get rid of those things. We have that at my office, by the way, too. It's called Scream Cream.
Scream cream?
Yeah. We use that, and believe it or not, we probably all have had it in our households from time to time, everybody at my office to try it out. But yeah, that's what it's called, Scream Cream. Pretty neat. That's all I'm gonna say. Because remember, sometimes it's all about us, it's not all about them, right?
Yeah, absolutely.
So. Nice.